Hello everyone, welcome to Psych Solutions, where we discuss all things mental health. I'm Dr. Peak. I'm outside today, it's beautiful, and in this video we will cover how to search for good fit mental health professionals. We'll discuss covering the cost of treatment, the types of providers available, how to find and research providers, scheduling that first appointment, and what to expect during that initial session. If you clicked on this video, you are likely considering seeking professional support for your mental health symptoms. Or maybe you currently have a therapist or psychiatrist, but you aren't quite sure if it's the right place for you. Maybe you are helping a loved one make an appointment. First things first, let's acknowledge how significant this decision is. In some families and within our society, the stigma around mental health issues lingers, even in this country and even though it is 2021. This can be a barrier to individuals obtaining the help they need. So kudos to you for making this decision. Since access to healthcare is not equitable in this country, let's first discuss what should never need to be discussed. How does one cover the cost of mental health care? Traditional health insurance through an employer will cover most of the cost. Maybe you are on a family plan through your spouse or your parents. The Affordable Care Act exchanges specific to your state and county also offer traditional plans. These plans often have deductibles and copays that vary. Mental health treatment is often considered a specialty, which would fall under the specialty copay. You can log on to your plan's website and find a list of covered therapists and psychiatrists. You can also call your plan and ask them to send you a list of options. Try and print this list to make notes as you call around to get information. If you are interested in a traditional plan through the Affordable Care Act exchange, you can check out healthcare.gov and see if enrollment is open or if you qualify for a special enrollment period. If you have Medicaid or Medicare coverage, look online for the list of covered providers or call the number on your card. Your cost should be low or zero with these plans. Insured individuals are protected by parity laws for mental health care, meaning insurance companies are required to cover mental health care the same as they would diabetes or high blood pressure. Some plans, however, still get away with not offering coverage for the treatment of substance use disorders, so be sure and ask about this when shopping for a plan if you foresee needing this type of treatment. If you are a person without health insurance, you could search online for terms like sliding scale providers in Kansas City, affordable mental health care in Lexington, etc. Sliding scale means the amount you pay for the service is based on your income. Most counties or a surrounding county will have community mental health centers or university clinics offering affordable or free treatment. Many clinics and nonprofit organizations offer scholarship applications and financial aid programs, so it is worth asking about these when making calls or looking at websites. A word about telehealth. The pandemic allowed for relaxed regulations due to the state of national emergency, and these relaxed rules are likely here to stay because access to mental health care has greatly expanded, which is great. So you are no longer restricted to providers in your local area. So a Google search for sliding scale telehealth psychiatrist or affordable telehealth therapist could also be fruitful. I see ads daily for new apps and virtual clinics offering new telehealth options. If you have insurance but want to see an out-of-network provider, you can download or ask for a claim form from your insurance company. You go to your appointment, pay the out-of-pocket rate, then ask the therapist or psychiatrist to help you complete the out-of-network claim form. You can send this form to your insurance company and they will reimburse you at your out-of-network benefit level. Often, this can save you 50 to 60% on your cost. Moving on to the different types of providers available. Medical literature supports the philosophy that for moderate to severe mental health symptoms, medications and therapy do work better together. So ideally, finding a psychiatrist or a psychiatric nurse practitioner and a therapist to work together as a team is the best approach. That being said, maybe you only have the bandwidth for taking medication right now, rather than more frequent therapy appointments. Or maybe you feel very guarded about medications and only want to pursue therapy. This is all completely understandable, and most mental health professionals are very willing to meet you where you are and discuss your concerns and barriers. So start by deciding what type of treatment you resonate with right now and what your current functioning and life season will support. If you are struggling right now and don't have the motivation and energy for the researching and scheduling with a mental health professional, consider asking your friends or family to help you on the search of scheduling that first appointment. Your primary care doctor's office can also make a referral appointment on your behalf, and then all you need to do is show up. Many facilities have both psychiatrists and therapists for one-stop treatment planning, but it is also perfectly fine to schedule at various facilities or practices. Let's look at different types of mental health professionals that can prescribe medication. First off, psychiatrists. These are medical doctors who complete 4 years of undergraduate training, 4 years in med school, and then 4 years more of residency in psychiatry. Potentially even longer if they are doing a fellowship in a subspecialty of psychiatry like addiction psychiatry or child and adolescent psychiatry. They receive intensive training in psychopharmacology and therapeutic approaches. Psychiatric nurse practitioners are considered mid-level providers, and they train as undergraduates in nursing, then complete 2 to 3 years of training to become certified psychiatric nurse practitioners. Depending upon what state they are licensed in, they may or may not need supervision from MDs to prescribe medications. If you've tried multiple medications for symptoms in the past, or feel your situation is more complicated, consider scheduling with a psychiatrist, as they do offer more advanced decision-making and can manage more complex patients simply because they have more years and experience in training. Family doctors, gynecologists, and physician assistants are also often willing to prescribe medications for mental health symptoms, and this can work well if symptoms are mild, or you are in an area where finding psychiatric referrals is impossible, and if your symptoms quickly respond to treatment. For moderate to severe mental health symptoms, it is best to seek out that specialty care because psychopharmacology is quite complicated and nuanced. As a psychiatrist, I would not try and treat diabetes or deliver a baby, even though I probably could in an emergency because I did have the training, but I realize I am not qualified to do this as standard practice. If you are looking for therapy, these professionals come from many backgrounds. Psychiatrists incorporate therapy with med management. Social workers offer case management and supportive therapy. Counselors offer marital and family therapy. Psychologists might offer psychodynamic and interpersonal therapy. Psychoanalysts train for many years to offer the stereotypical Freudian dream analysis experience. And some churches offer pastoral counseling. There are many types of therapy we can go over in future videos. If you take a presenting complaint of depression and run it through the filters of each type of therapy, the approaches to treatment are very different. For example, cognitive behavioral therapy would focus on working with the negative thoughts associated with depression and might be time limited to 6 to 12 weeks. Whereas a psychodynamic therapist, usually an MD or PhD, would spend time unpacking childhood relationships, behavior patterns, motivations, etc., and could be a year or more of sessions. At this point in the process, you know which type of treatment you prefer, how you might cover the costs, and you are ready to begin the search. Start with the list of covered providers from your insurance company or your Google search list for sliding scale clinics. Look at websites closely and read the bios of the providers. Bios often include their special areas of interest, if they are taking new patients, and often their philosophies of treatment. Look for a policy or statement dedicated to diversity and inclusion. If all the images on the site are of heteronormative white humans, then it may be that the facility has some work to do yet. Often facilities will post newsletters or have links to social media accounts. You can also ask trusted friends and family if they have recommendations. You can ask your family doctor if the office prefers a certain provider or clinic. Reading reviews on providers has pros and cons. Sometimes clinic staff make direct asks of agreeable patients or clients to write positive reviews on certain websites, so the ratings are skewed. Sometimes patients who are upset about not receiving a certain medication write negative reviews. Reviews are helpful for getting a sense of if the office staff are helpful, how efficient they are at calling a patient back, etc. If person after person complains that a certain provider is rude or dismissive, then yes, move on to the next. But if in general people seem pleased with a certain provider, but there are a few negative reviews about medications or referrals to higher levels of care, the facility or clinician still might be worth checking out. Make a list of questions to ask when calling together information and potentially schedule. Questions like, what insurance plans do you accept? Do you offer telehealth? How long is the wait time for a new patient? Will I see the same provider each visit? This is important because of course it is better to have continuity of care. In some university settings or larger clinics, this may not be guaranteed. You can also ask, if my insurance is not accepted, will providers complete out-of-network claim forms for me so I can be reimbursed? You could ask, how long is the first appointment? Initial appointments with a psychiatrist or therapist should be at least 45 minutes to an hour. Scheduling new patients for brief initial visits is a red flag in my mind unless they are working you in for an urgent need and plan on a longer history gathering session later. There's a lot to consider on those first few visits, and the providers should be interested in getting to know your history and developing rapport with you. Ask about how long follow-up appointments are. These can range anywhere from 15 to 30 minutes for prescription follow-ups. Therapy sessions usually stay at 45 to 60 minutes each visit. You could ask, how are after-hours calls handled? So what to expect on your first appointment? If utilizing telehealth, you will be asked to complete a few forms before the appointment. You may be asked to download an app, register for an account on their medical record platform, or they may just email the forms. Someone may call you the day before your appointment to remind you of the visit, get a list of your home medications, and give you instructions on how to connect virtually to your first visit. If in person, you will be asked to arrive a few minutes early for paperwork, or the practice might take care of this electronically prior to the day of the appointment. You will likely be asked some basic screening questions about your home medications, your vital signs might be taken, and they will likely collect your copay or payment prior to the actual visit. During your first session, the providers will ask questions about your symptoms, your reasons for seeking treatment, your past history, your relationships, education, medical history, and they'll go over your medications. They may ask you to complete some scored screening questionnaires for baseline data on the severity of your symptoms. If you are prescribed a medication, the doctor or nurse practitioner will go over side effects with you and tell you what to expect as far as time to efficacy and when you should follow up. If you are starting therapy, the therapist will ask about your goals and begin to discuss a treatment plan with you. Either the provider or the staff will schedule your next visit before you leave the office, or they may call you after the telehealth appointment. You will likely feel multiple emotions simultaneously after leaving that first appointment. Patients have reported feeling relieved and hopeful, certainly, yet sometimes they report feeling overwhelmed, sad, confused, scared. This is normal and common. Discussing mental health issues with a new person is a big step. Sometimes content is shared that maybe you haven't thought about in a long time. Be gentle with all the feelings that might arise, and if you can plan to take the day off or have a friend plan to chat with you afterward, this can be helpful. I hope this was helpful. My intention was to provide an overview from thinking about seeking out a mental health professional all the way to the end of that first visit. And I hope it provides you with some support and guidance. It's not always easy to navigate the mental health care system, so please ask any questions you have below, like and subscribe, and thank you so much for watching.